I mean, that is the look that I would die to have, right? And it's like,
Thank you.
I mean, it's so perfect for you. You look fabulous. I know we're not supposed to comment on how people look, but.
Lindell, thank you for spending time looking over the statement, the summary statement. Your feedback was helpful. I don't know if you saw, I
just got it, actually. I just saw it. Yeah.
Okay. I hope you're okay. I just went ahead and submitted it just to get it off and running so I could start the next year's report. So, but thank you for the feedback. I think it was helpful. And it to your read, it was plain language enough. Okay.
Yeah.
I tend to write that way anyway, but
yeah,
you
did. So. That was great. Thank you.
Great. Glad to hear that. Thank you for your help.
Sure.
Someone was asking about how many people registered earlier. I'm not sure if this number includes panelists or not, but here in the info for this, it says total registrants 19. So.
Okay.
Hey, Jeanette.
Good evening, everyone. Good evening, Jeanette.
God, I see you took your name out of the report. You put everybody else's name in there. You acknowledged everybody else and yet did not acknowledge yourself.
But I'm listed as the staff contact. That's enough, right?
You carried an amazing load. I'd love to see people see that.
It's inferred. It's inferred.
No, it needs to be explicitly stated.
I already submitted the report, so you can't be changed now.
Next time. Too modest, Todd.
We don't know if we're expecting like the full commissioners tonight or the full commission because it's a separate special meeting and primarily the community engagement committee, but I guess we'll just determine at some point. We think this is everybody that's showing up, right?
I know it's the community engagement. I just assumed all the commissioners would show up. I guess thanks for pointing that out.
Are you, Ernest?
Good evening, everyone. Good evening, good evening.
Good evening, Ernest. Well, I want to be respectful of everyone's time, so we'll go ahead and call this meeting to order at 6:30 p.m. We're going to do roll call, Todd?
We will. And here comes Mary. That's good too. We'll go ahead and do a roll call and then we'll just add folks in as they arrive. Jessica.
Here.
Ernest.
Here.
Jeanette.
Here.
Mary.
Here.
Wow, that was like perfect timing. We'll wait for her to connect. Okay, Wolfgang. You are welcome, and are you here?
I am here.
Great, you joined just as I was getting ready to call your name. I don't see Erica. And nor Andy. And Lindell.
Here.
Oh, and I skipped Catherine entirely. Why did I do that?
I'm here.
It's not intentional. Sorry about that. Okay.
Who's Quinn? Sorry, managinglove.org. Oh, hi. I'm sorry. Are you a participant?
I'm just an attendee. I don't know how I ended up on the screen. Sorry to
Okay.
crash the party.
You got the special spot.
Yeah.
Maybe who?
That was me. That was me. I didn't know what attendee was one, so it was a link I sent. So that's all my fault.
Oh, you shared your link.
Yes, that was
Gotcha.
what. That's what happened.
I think we might be able to move you to.
Thank
I moved
you.
over to attendee.
Thank you, Machine. Sorry, it's kind of like caught me off guard. Okay, so now for the reciting of our amazing mission. Act as a strong advocate
Advocate
to
justice,
Justice,
equal
equal opportunity,
by
providing
providing
citywide leadership and guidance in the area of civil rights.
civil rights.
I love it. It's always so awkward but beautiful. So I wanted to thank everyone for coming tonight for this special town hall. Todd continues to remind me that we are launching a new territory. And so I appreciate all our commissioners for being here, for the community members that are present. We're so eager to hear from you. This is going to be an active listening session where we will hear from the public. You'll have 3 minutes to speak, and we're listening and not, we'll be taking this feedback into our retreat. So the commission welcomes you for comments and questions and commits to listen carefully and thoughtfully to what is presented. There will be a maximum of 45 minutes allotted for each topic during the town hall meeting. Each speaker will have 3 minutes to speak. The commission requests that members of the public refrain from engaging in personal attacks against commissioner and staff members and ask that comments and questions focus on matters related to human rights within the city. So we're going to jump in with our first topic, which is emergency housing. The commission seeks comments that addressed framed in 3 different ways. One, if you're able to tell us like what is working, what is not working, and what needs to be improved about emergency housing. And we have some hands raised and we'll go ahead and jump in. Sage is the first person that I see with their hand raised.
And just if you can
yep.
give me a minute to get the timer up, that would be really
yes,
helpful.
I'm just gonna say, let me give a minute of time to do the timer.
Okay. This
you
shouldn't
could
take but a second. All right.
And for those that will be speaking, if you could please identify, like say your name when you speak, so we have that in our notes moving forward. Okay.
Can you all see the timer?
Yes.
I can't see your screen anymore, so thank you.
Hello, my name is Sage Boyer and I live here in Charlottesville. And I heard that this was about affordable housing and all that. And I just want to say, like, most of the affordable housing in Charlottesville is unaffordable for people that are on SSI and SSD. We only make like $841 a month. And most of the low income places are like around $800 a month. That's all.
Sage, thank you for your comment.
Up next we have is Rich Gregory.
Thank you, Lasheen. Oh, I paused because I wasn't sure who would be calling it out. So thank you.
Good evening. Would you all please have someone read your mission again with more than one of you all chanting the mission? It's unintelligible to unfamiliar folk.
Sure. Do you have more to say? Or is that you just wanted to hear the statement again?
I could start over when you all are through, when someone reads the mission.
Sure. Okay, I can read it for you. The mission of our commission is to act as a strong advocate to justice, equal opportunity by providing citywide leadership and guidance in the area of civil rights.
Okay. Well, I am the treasurer of the Alliance for Interfaith Ministry, and one of our tasks is to help people get affordable housing. people who are unemployed, or people who are on disability, or people who are retired. And like the previous speaker said, there is no such thing as affordable housing in Charlottesville. AIM has had to change their bylaws so that we can house people in surrounding counties because there's nothing here in Charlottesville. You can get on a waiting list, but you cannot move into an apartment pretty much ever. That's all I have to say.
Thank you, Rich, for your comments.
Up next, we have Anna Mendez.
Good evening, members of the commission. Can you hear me well?
Yes.
Thank you. My name is Anna Mendez. I am the Executive Director of Partner for Mental Health here in Charlottesville. At Partner for Mental Health, we have observed that many of our community members who have been banned from emergency housing options, including the Salvation Army and PACHM, are disproportionately people that live with a mental health diagnosis. We are really grateful that we are able to connect with some of these individuals. And we're also very grateful for the partnership that we have with TJAC that has allowed us to help some of these individuals who are prohibited from using the emergency shelters that we have with motel rooms. And what we have found is that with the right kind of skills and values, we are able to help people, the majority of these individuals live very successfully in those settings. And so I think we would encourage the city to invest in helping all service providers who are providing emergency shelter to people who are highly likely of having some type of behavioral health condition, to really invest in the professional development skills and values necessary to most effectively interact with individuals who are living with these conditions. And that will, in our observation, will result in their ability to maintain shelter in a way that currently is inaccessible to them. Thank you very much.
Thank you, Anna.
And then the last person with their hand raised is Nancy Carpenter.
Thank you, and good evening, Commission. Thank you for this opportunity to speak. I take emergency housing as talking about emergency shelter, right to shelter, and that's something that I don't know if the city could do on their own. The previous speaker was talking about individuals that are not able to access the current thermal shelter during the cold season and the only year-round shelter. We also have people who don't access shelter who would like to, but because they have four-legged friends or four-legged family members, they don't access shelter. There are also folks who don't want to necessarily split up to go into shelter the way that it's set up now. I don't know what I think the answer is more housing than it is really emergency shelter, because I know that, you know, like you say, TJAC has gotten a lot of CARES money and ARPA money, whatever, through the city has as a pass through, and use that through TJAC to do that. But I don't think that well is gonna be, you know, that deep going forward. So I think the focus needs to be on how do we advocate for and find policy that will have deeply affordable housing options. And it's, you know, it could be apartments, it could be something else, but I think that emergency housing needs a definition. And if it's shelter, maybe that's not the option to look at. If it's emergency yeah, it's a lot of different things, and I'm sorry I'm getting a little tongue tied, but it's a lot of thoughts are going around in my head right now. But I appreciate you taking on this topic through this committee, and hopefully you'll get some feedback that will be able to help you create some talking points and some policies that the city could enact to help citizens, people who are like this young lady who was talking about being on a monthly benefit. You're right. Our government doesn't keeps people in poverty who have disabilities and are unable to work. And things like that. So thank you and good luck.
Thank you, Nancy. Shima, before we call the next one, I've seen people are coming on as we join, so I just want to refresh that currently we are on the topic of emergency housing for 45 minutes as allotted, and we're asking that when you speak, please introduce yourself, and we're asking if you can provide comments related in a framework of what is working, what is not working, and what needs to improve regarding the topic at this moment about emergency housing.
Up next, we have Gwen from managinglove.org.
Hi, my name is Gwen Cassidy, and 10 years ago, I was homeless, living on food stamps, showering at the Haven while living out of an office on the downtown mall while starting grad school at UVA. Yesterday, I received my first certificate from Harvard in creating sustainable cities and communities. And humbly, the United Nations deems me an expert in global homelessness. I presented twice at the last Intergovernmental Dialogue on Global Homelessness before COVID in New York, and sat next to His Excellency from Finland to the United Nations, where they have zero homelessness. They don't have a single homeless person in Finland. And that's due to the housing first policy. It's been, I'm also doing a documentary called If It Could Happen to Me, It Could Happen to You, from Homeless to Harvard. And essentially we interview experts around the globe. And we also interview all of my friends who are currently homeless or who have underwent homelessness at any time in their life. The primary thing we need to be focusing on is housing first policy. And also the other facet is, sorry to not be so humble here, but for my Harvard capstone, I'm designing the first net positive small home community for the currently homeless vets in the Charlottesville area. And I just think that, we need to focus on a lot of issues, but homelessness and affordable housing, it needs to be at the top of the list. Thank you very much.
Thank you, Gwen, for your comments.
Up next, we have Rich Gregory.
I spoke a little earlier. I said I was the treasurer of the Alliance for Interfaith Ministries. What we have found is the elephant in the room is the University of Virginia. Their housing policy is we will charge market rate for students, and it drives up the cost of housing for normal people. Ideally, UVA would have 100 free rooms available at any time with wardens and support people so that homeless people could make use of this facility. But UVA is not doing enough. Thank you.
Great comments.
I don't see any other hands raised at this time.
I know we had 45 minutes for this section. I'll just give a call again that we're on the topic of emergency housing. And just to remind everyone that we are actively listening tonight to take your comments back and reflect on the feedback that the community has provided for our upcoming retreat in April. And so I don't want to move off of this prematurely. We'll wait in awkward silence for maybe a minute or so if anyone else has further comments on this before we switch the topic? Ocean.
Let's see.
Hi, Commission. My name is Ocean Aiello. I am a staff member at the Haven Day Shelter downtown. I'm grateful for this space and to be talking about this. And I think similar, that's my timer for dinner going off, but similar to kind of what Nancy mentioned, I wasn't really sure exactly of the definition of emergency housing, but I did take that to mean access to overnight shelter. And I really appreciated Anna Mendez's point of the folks who are unable to access Salvation Army, which is a higher barrier, but the only year-round shelter, and Pacham typically need, extra support and folks who are able to, provide skills and what they need. So I would say that this is probably a relatively small number of folks, but need additional support. So I think focusing on and talking to the people who are a part of that group would be massive. And then, of course, like all of this to say, like, yes, echoing what everyone said, I mean, the solution to homelessness is housing. And in order to rapidly move people out of homelessness, like we need access to housing and more vouchers along with supply to quicken that experience for anyone and ideally prevent it. But I appreciate, this conversation, and thank you all for the ability to speak.
Thank you, Ocean. Before we call the next, if you are, have you called in to the Zoom, you're also able to raise your hand by dialing *9.
Up next, we have Daniela Pretzer.
Yes, hello. My name is Daniela Pretzer. I am the executive director of the Bridge Line. We're a nonprofit organization serving adults with brain injuries. And I know this is about emergency shelter and housing. I also want to point out within the homeless community, at least 53% have a brain injury. And the problem is that often people with brain injuries are less understood because they have behaviors that are kind of out of the norm. And I just appreciate this conversation. And the other thing I wanted to say is if emergency or any affordable housing is created, it can be accessible because accessibility works for everybody, not only for people with disabilities or physical disabilities. But my main concern is really people with brain injuries who are off the norm, and they might have behaviors that are offensive. People might think they're drunk, they're not. So always wondering about, is somebody possibly in this community of brain injured people is really a good question. They have typically no money, very little. We talked about SSI or somebody about SSDI, which is really very little, $700, $732. And it is important to live in Charlottesville for people like that or close because the medical community is around here. So they can't live in, I don't know, Buckingham County out there where they can never get to a doctor. They can never have any community. So the consideration that this is within our community is really important. So I don't want to go on, but I think I just said what I needed to say, and I really appreciate you doing this. So thank you very much.
Thank you, Danielle.
Up next is Nancy Carpenter again.
Just real quickly, a thought about emergency housing came to me. One of the things that you might want to think about is respite emergency housing for those who are coming out of UVA. that, you know, don't have a good housing plan or any housing plan, and they do need to be able to recuperate a little bit. That's another need that kind of touches all these different areas that people are talking about, is how to, you know, create some medical respite beds. I think it's Micah Ministries in Fredericksburg. Don't quote me, but I think that they have some respite beds for folks. And then that also, you know, it gives a little more time to, you know, create a housing plan of some kind. But I just wanted to throw that out there. If you're talking about emergency housing, that medical respite is an important piece of that. Thank you.
Thank you, Nancy.
Next is Sage Bauer.
Hello. I just wanted to add in one other thing. As far as people on SSI not being able to afford housing. Women who are on SSI and disability are more likely to stay in financially and like physically and like domestic violence type situations than people who could afford to just leave. And so I just wanted to add that in. So that's something to also think about. A lot of people on SSI and SSD are also in volatile relationships.
Thank you for that. I just want to pause and say, I know that we're not able to give comment back to you, but the human side of me just wants to thank everyone that is being so vulnerable and being on here to share. Like, I appreciate it. I see you and I hear you, and I thank you for the courage to come on and speak tonight. I know it could be uncomfortable. Again, I just wanted to give a little bit more time. I'm trying to push it to 7 before we switch the topic. Again, if you're on the phone and you want to unmute, it's *9. If you're on Zoom and maybe not as familiar with raising your hands, if you look at the bottom of the screen, there's like a dot for more. No, it's not. That's not how you do it. There should be a sign that just says like raise your hand on here. So again, we're currently on the topic of emergency housing. This was based on a poll that we sent out, and so we did not have it defined. So I love that that is coming up. But if you still would like to give comments, we are here listening. Again, if you can frame it in what is working, what is not working, and what needs improvement. And if you're on Facebook, if you could join us via Zoom, if you type in charlottesville.org/Zoom. If you're on Facebook, come join us over here on Zoom. We'd love to hear from you. I'm purposely having us wait in this awkward silence, just to be clear.
We have Ange Khan. You might have to unmute.
Yes, I did. Thank you.
There you go.
So on the topic of emergency housing, are you able to hear me now? Hello?
Yes, we
Hello?
can hear you.
Okay, thank you. So on the topic of emergency housing and all of the great input that was that came before my comment now, we also need to think about having or emergency housing, actually, or something like that, but also have those like a hotline and outreach. What I've noticed is that there isn't a line for people to call on the weekend. To, a lot of places require having an intake, or they have to present to the ER, or they have to encounter the police department. in order, sorry, my dog. I know, no to police, I got you, baby. But they do actually, like, they do have to encounter one of those two. They either have to go through the emergency room, or they have to go through the police department in order to get a referral. And so that would be something also to look at if we're thinking about access and you know, how do we emergency I did like the idea of the respite emergency. That's pretty great. But if you think about that, like, we need to also be thinking about the traumas that have been imposed on people who have encountered the healthcare system, and you know, maybe have not been treated so well, and also the impact that it has on the healthcare system as a whole, right? You know, so I just wanted to shed that topic, and I don't know how to mute.
Thank you, Ange. We'll give again to the top of the hour for more questions about this topic of emergency housing. And again, if you're on Facebook, come on over and join us here on Zoom. It's charlottesville.gov/Zoom. And if you're on the phone, you can unmute by dialing *9.
We have Gwen.
Hi, thank you again. I also think that they should implement some sort of development tax, especially for all these high rollers who are developing $1 million townhomes, you know, in apartment buildings, condominium complexes, the whole 9 yards. There should be some sort of development tax where they're taxed and then it's allocated for emergency housing services. And there are other, you know, health aspects, like similar to Boston. We should be emulating, you know, what's working nationally and domestically and internationally. But certain agencies that we need to focus on helping, obviously, are Pacham and the Haven and Salvation Army. And we also need to be doing more collaboration, I think, amongst those agencies as well as TJAC. But yeah, that's just what I want to say. Tax the rich.
Thank you for your comment. Okay, I'm gonna give like 30 seconds for any last comments on emergency housing. I guess, Todd, is it possible that if we move on from this and people maybe still have comments on this, that we maybe can cycle back?
That is entirely up to the chair of the commission, and if you would like to do that, yep.
So I'm gonna change that a little bit. So we're gonna move off of emergency housing. We did say we'd have 45 minutes, but I don't see any more hands raised. So I will move on to our next topic. And if there's time allotted, I'll circle back for any final comments. So we'll move on to quality of affordable public and subsidized housing. Again, the commission seeks comments that address what is working, what is not working, and what needs improvement on this topic. Again, if you're here on Zoom, raise your hand. And if you're on your phone, you can dial *9. And again, if you're on Zoom, if you're on Facebook, come on over here and join us on Zoom.
First up is Nancy Carpenter.
I wish I could be there and just sit around and have a cup of coffee with you folks, because that's what I feel like we're having is coffee chat. But when it comes to affordable housing, what's not working right now, the city policy, I mean, it's great that they have their own rental voucher program. I think it's a 2-year, 1 year or 2 year program for folks. But what's not working right now is that the rate of increase in rents have locked some people out of using those vouchers because the amounts are so, well, they're lower than what they should be. I mean, I think they are 125% of fair market rent, but I know that Click has made an ask to increase that to 150%, although there is some question about, and I'm hoping to find information from CRHA about people being able to transition out of that city rental program into a more mainstream housing voucher program. As to how many people have actually done that, because there was a concern about the difference between the 125% and 150%. Could the city create a policy where they could look at monetarily what that kind of difference is and pick it up? So I think what could work is increasing their voucher amount to 150% of for their payment standard is what I'm talking about, their payment standard to fair market rent. I think another thing that isn't working that well is when the city takes proffers from developers on we're going to have affordable apartments. I think that years, instead of 5 years, 8 years, I think it should be 15 to 20 years that you keep that unit affordable. And I think a lot of this will be able to be reviewed when they get a housing coordinator. And I think somebody said something about collaboration between agencies, and I think that's a very good point, because we all want to we all want to see people housed. You know, we believe in housing first, you know, and all of that, but all the agencies are scrambling for these grants. You know, many agencies go for the same grant and they can't all get 100%. And so I think that we need to figure out a way locally how to level those boundaries between our agencies, because I can think on one hand, we've got like 6 housing navigators in different agencies. And I'm even including Todd because I know he takes on a big role with that sometimes. We've talked so much in the past. So I think that, you know, if we have 6 housing navigators and we've got different types of assistance programs, you know, to work towards, and I think we are, but to work towards better service delivery so we can have better outcomes with affordable housing. That's one thing. So thank you for letting me take a little bit longer in my coffee chat on affordable housing. Thanks.
Thank you, Nancy. It does feel like that. I'm glad you feel comfortable like a coffee chat.
Up next is John Sales.
Good evening, everyone. Well, I really just got on so I can answer Ms. Carpenter's questions about the SISRAP program, which is the City Supplemented Rental Assistance Program. So my name is John Sales. I'm the Executive Director of the Housing Authority. The program does go up to 125% fair market rent. We received an increase, or I asked for an increase to the program, I think it was last May, just because we were seeing the challenges that the HCV program was having renting units in the city and in the county. And so the program has a requirement that the families search in the city before they can search in the county. And so I asked the council to increase the fair market rents for the city so more of the families can live here, because most of the families want to live in the city. They just have a hard time finding units that qualify for the program. And so I did get a request from the city, I want to say it was this morning, to look into the 150% AMI increase. I do have a couple concerns about it. If you don't add additional revenue, you reduce the amount of vouchers and families you can assist. So that's a big negative in my eye. And the other issue is the program was designed so if you went from the SISRAP program to the HCV program, it was like a program that was created to fill the gap. So when families are transitioning to the next program, there is something there to protect them and secure their housing. If we go up to 150%, that's guaranteed that the family will not be able to stay in that house once they've received the voucher for the federal program, because the federal program only goes up to 110%. So they're guaranteed to have to move. Moving can be a challenge. It's costly, and it's something that the family will have to pay for. And they'll stuck trying to find another unit that they can afford. This could be a few years. I mean, it could be 5 years. The program does not have a term limit. There were conversations at the last meeting about potentially at the last council meeting where this was discussed, which was in May of 2021, about the program adding term limits, but that was not decided. So there are no term limits. So we do have individuals that have been on the program since creation, I think in 2018. I'm trying to think if I have anything else. The HCV program is 110 now. We just increased it in January of this year, January 2021. The board voted to increase the fair market rents to up to 110%. So that's up from 100%, which is where we were a year ago. It is not on pace with the market itself. We know that, HUD knows that, but they don't plan on funding it at the level it needs to be funded. And every locality is seeing the same issues we're seeing, where families are moving further away from the city or taking the full term to find a unit, which is 120 days for most voucher holders. If you are disabled or elderly, then you get up to 150 days. I think that's all I have, and I'll be around to answer any other questions that may come up during the meeting.
Thank you, John.
Up next is Sage Bauer again.
I just wanted to like add on to like where he said that, you know, people are moving further and further away from the city. I just want to tell you like the kind of places that these people are moving to, because I know, because I've lived in them types of places. They're private owned, they're cash only, and they're basically just homes owned by slumlords. Like there's generally mold, things that are broken, things that don't work right. The houses are just absolute, like these places are just absolutely like disgusting. So that's where these people are living. And if it wasn't for my partner, my current caregiver, I would be in a place like that, like something that had mold and leaks and other types of issues. So like it's also kind of, you know, so like whatever solution y'all come up with, I hope it's a really good one, because like you shouldn't have to live with a slumlord. I've had my fair share of those in my life. The one that I had prior to moving to Virginia, I lived in Detroit, and the sewage would back up into my basement in my house. And I had a toddler, and it was disgusting. That was where I was living. And then I lived in a little place called Berkneal for a while, and the house was moldy. So I just wanted to say, like, that's what these people are facing. That's all.
Thank you, Sage. Again, we're on the topic of quality of affordable public and subsidized housing. We're here to actively listen. If you are on Zoom, you can raise your hand, provide us your comments. And if you're on the phone, you can press *9.
Next we have Ange Khan.
Okay, I think I'm on, is that correct?
Yes, you are.
Okay, thank you. So when we're talking, but again, affordable doesn't mean accessible, and can always say this, only because there are so many barriers and loopholes that landlords, you know, create to keep low wealth individuals out of their units. You know, that's really one thing to really focus on, is how to make it such that like where there's like rent freezes, right? Where you know, there's like rent caps, because that's what's needed. I checked an apartment complex that was just $1,300 about 4 weeks ago. It is now $1,519 for a 1-bedroom. You know, that is not acceptable anywhere. So possibly looking into that and seeing how that could be accomplished when we have so many folks that you know, are with rent increases going up to $200-300 a month. When you have properties that if you don't pay your rent, and this is coming out of COVID, if you like this is where we're trying to enter back in. We're not completely out of COVID, but what I'm saying is this is coming out of like towards the, I'm not even going to say end, but you know, coming out of, you know, what we've been through the last 2 years, where people are being evicted or their leases are not being renewed because they have not made 6 consecutive payments, and not taking into factor that people could have been sick, anything could have happened, but it's really like the amount of power we give landlords in our community, and they're not really serving our community members correctly and fairly. And that's all on that.
Thank you, Ann.
Up next is Daniela Pretzer.
Yes, hi, La Pretzer again from the Bridgeline, serving adults with brain injuries. And ignorantly, I guess, I didn't realize there are 2 parts of this town hall meeting. So my really passion is affordable housing, because if you talk about all you have is $700, $732, I should say, it's not a lot. So I've always tried to learn more about it. And there's somebody from the city here. We own 2 homes. We have, one of our programs is a residential program, which has, one house has staff all day in there. The other one checks in, and we have an empty lot, Meridian Street. And my dream, my thought was starting to have build a house there that has, I think we could have 4 or 6 very small apartments and common area. And I talked to somebody at the city about the zoning, and the problem was, if you remember the Hinton Avenue, the church, the zoning was a battle, because everybody loves, of course, housing for people or apartments for people with disability and low income, but not in my backyard. So, and that was really disturbing to me. But to me, we have this empty lot. I would love, so if you know anybody who wants to build or help building, help constructing this place, I'd love to talk to that person. And we have, and with the idea, it's like Virginia Supportive Housing. There's a house in two houses in Richmond who are, there's a staff and it's for people with brain injuries. So I would love to have something like that here in Charlottesville. It is really, it sounds always like, yeah, it's brain injury, but it's so, everybody knows somebody with a brain injury. And you look at violence, home violence was mentioned, big issue. People who come out of prison, homeless people, all these people have no money but need a home. So we have something that I'd love to work with somebody. It's very small, but I think it could make at least a mini dent. So thank you very much. I'd love this conversation. Hopefully one day in person. Thank you.
Thank you, Danielle.
Up next is Alex Ikufuna. Hey, Alex, you might have to unmute.
Okay. Good evening, everybody. Can you hear me?
We can.
Okay. Yeah, I just want to respond to the one of the previous speakers regarding rent cap or rent freezes. The city would like to do that. However, the city cannot do that. But if it wants to do that, the authority to do that, we have to come from state lawmakers. You know, they have to authorize the city to be able to develop an ordinance that will make landlords, you know, to freeze their rent. They have those in California, you know, but here in Virginia, because Virginia is a Dillon rule state, it's pretty difficult to get such authorization from the state. So I just want to put it out there. Thank you.
Thank you, Alex. Again, the awkward silence. We'll try to feel a little bit of where we are if you're just joining us. We're on the topic of quality of affordable public and subsidized housing. We are here to listen. If you want to provide us comments about what's working, what's not working, what needs improvement. If you're on Zoom, you can raise your hand. And if you're on the phone, *9.
Up next is Sage Bauer.
Sorry, I have a lot of thoughts and ideas. I would really like to see like apartment buildings built that are suitable for children, that allow at least one pet, small pet. And, you know, they go based on your income, no matter what it is. So like if you're on SSI like I am, $841 a month, it should be like $350 to $400 a month to rent. That would be great. That's all.
Your room's upstairs? Open the door.
Thank you, Sage.
Up next is Nancy Carpenter.
You were saying what was working with public and subsidized housing, and I, think that, in my personal opinion, I think that the crossings is working well. I see that it's a mix of market rate and project-based vouchers. And I'm hoping that, of course, this comes, from a different level with the funding. It's not always city funding, but those kinds of programs, seem to work well. I'm hoping that this project out on 29, which right now called Premier Circle, as it's built out, even though that's right across the line, will be something, similar in that it'll be a mix of, well, you say market rate now and subsidized housing. I don't know what market rate's going to look like, but I also think that our social contract is broken with governance, not necessarily. because I really feel that our government has pushed so much on public-private partnerships that it's been hard to keep up. And I know that I'm glad Mr. Sales was on here, but I know that back in the recession of 2008, and what was that act called? There was a budget act that really constricted a lot of money in public housing for upkeep. I mean, they almost basically choked off funds to keep up public housing because it's two different funding streams. And I'm hoping that we have an unprecedented time right now to get some of that money back to levels that were pre-pandemic, and also to maybe pre-2008 levels, where we can begin the process of rejuvenating public housing. And I think we need to have more public housing. I know it makes more work for our local government, but I think that's an important piece of it, because until people see the benefit of having minimum wage, $8, I mean, $7.25 is just draconian, but people individuals and families, no matter where their income comes from, are going to need assistance. And I would like to see the city think about increasing public housing, increasing the profit, creating longer periods of time, and somehow requiring longer periods of time for profit departments, like the executive director from Bridgeline. There's a lot right there that could be a multi-unit lot, and just need to understand that this is how it's gonna have to play out, I think, in certain neighborhoods. So anyway, thank you.
Any other comments or feedback on quality of affordable public and subsidized housing?
We have Gwen.
Hi. One of the things I did in graduate school at UVA was canvass the 10th and Page neighborhood for AHIP and LEAP. And one thing that saddened me years later, after hearing about the neighborhood becoming gentrified, is that most people, they're in certain socioeconomic strata, like myself at the very bottom, home ownership is really the only true pathway to wealth and building equity, especially the legacy for families to carry on their homes and generate for generations in perpetuity. And unfortunately, if there's got to be some way to either, I don't like to use the word force, but have those individuals who are having their homes upfitted by taxpayer dollars, that they remain in the family. And that's just one thing I'd like to add. Thank you.
Thank you. I want to give it to 7:30 on this topic, so we can give equal 30 minutes to each. I know it's awkward silence, but I want to give an opportunity for those that still have thoughts on this topic. Again, I thank everyone for being vulnerable and sharing and boldly to come and speak to us. If you're on Facebook or other mediums, please join us here on Zoom. If you are here on Zoom and like to speak, raise your hand with the raise hand function. And if you're on the phone, attendees, you can press *9. We're currently talking about quality of affordable public and subsidized housing.
Up next is Rich Gregory.
No one has mentioned the efficient and energy efficient construction methods that would say, take this lot that's this speaker from Bridgeline just mentioned, and how could you, assuming you get the proper zoning, what would be the most efficient way to create an energy efficient set of apartments? 1 bedroom efficiencies, 3 bedrooms, etc., to help the most number of people, and then provide them with the support so they could stay in this neighborhood. That's all.
And then next we have Daniela Pretzer.
Yeah, I'm glad I can reply to that. I thought first when you said efficient, I thought energy efficient, because we have some years ago, I worked together with the architectural school of UVA to be, if anybody knows EcoMod, to build something that's really energy efficient. It was a great plan, but unfortunately, we don't have a certain government license that inhibited us from moving forward when we spent already a lot of time on it. And I want to say that to me, it is really, well, I thought when I think of this property, for instance, of not only somebody has a home, a permanent home, an apartment, but also there is somebody there who can look out for you. There's a staff person on site or close by, because I think that's important. And so I just wanted to, say that I'm glad this is in the discussion now. And I just, again, I appreciate that you doing this. I also want to take this opportunity to say, Gwen, great. We have met some moons ago, many moons ago. Congratulations to all you have achieved. And lastly, Wolfgang, that sounds very German. And Capley, not so much. So, but anyways, that's it. So if anybody has an idea for us to do anything, I'd love to hear it. Our mission is to serve adults with brain injuries, but remember, a brain injury can be a stroke, a trauma, a tumor of the brain, an infection of the brain, and everybody knows somebody in this category. So if there is somebody who wants to talk to me, the Bridgeline is, the emails and connections are on sites, are online. So thank you very much.
Thank you. All right, we're right at 7:30. I know it's on here, but I just want to freestyle this last section. That I'll give a few more minutes, just for any final comments or any things you want to contribute specific on the 2 topics for tonight, either emergency housing or quality of affordable public and subsidized housing. Again, I thank everyone for their comments, but if there are any final thoughts, things that you'd like for us to share and take into consideration as we go into our retreat next month. Again, if you're on our Zoom call, please raise your hand. And if you're on the phone, press *9. And if you're on Facebook, come on over here, or on Twitter, come on over here to Zoom. We'd love to hear your feedback. Any last comments? I know it's weird, awkward silence. The extrovert in me hates it, but I know I want to give space if there are any final comments tonight before we log off.
We have a hand raised. It is Rich Gregory.
Are you all able to distribute a transcript of this meeting? Are you able to distribute a mailing list of the people who attended? Say I wanted to connect with the Bridgeline. It would be nice if I just received that in email and we could start talking. That's all.
I see Ernest and Lindell's hand raised.
Lindell, you can go first.
I was just going to ask a question. I don't know how open the chat is, but I'm wondering if people want to share their email contact information, if that's something we can offer. I don't know.
It's disabled right now for the community, for the attendees to chat, but I can open it if you guys want to be able to put your emails in them so they can see it.
So just to make aware that this is to the question about transcript, we do have notes from this meeting that will be published. But if you feel, if the chat does open up, if you feel comfortable to put it there. Ernest?
No, Lindell took the words right out of my mouth as far as being able to do that. We could share information, Hope and Bridgeline could get with Mr. Gregory or even with Gwen about, some housing opportunities, tiny homes or something like that, as well as I want to ask Daniela about our dementia on Alzheimer's considered in the brain injury designation for you guys.
Up next is Daniela.
By definition, it is not, because it's something that is a brain. We're not really as strict as the American Brain Association, American Brain Injury Association, and the CDC, because it's really something that happens after birth. But it is something that the four things mainly, trauma, tumor, encephalitis, and stroke. I appreciate the question because me personally, I agree that is a brain injury, but that's not something we can serve. So I'm very sorry. I'm sure you know somebody, otherwise you wouldn't ask. And I'm sorry because this is so hard. I really am. And we go beyond the very strict definition, because if somebody has cerebral palsy, that's not considered a brain injury according to definition, but it is. So, but if you wanted to talk to me, I was about to put it in the chat. You can also go to the website, the Bridgeline. There's a contact information. You can call me. I'm happy to talk about Alzheimer, Parkinson, whatever it is, because I know how hard it is for everybody. Brain injury, for instance, it's not the person only who's injured, it's everybody, the whole family, the whole community around. And I do appreciate it. And I really, I'm sorry. So, but contact me if you want to talk and vent, whatever it is. So I put my email in the chat. Otherwise you find me easily on our website. Thank you so much for the question though.
And up next is Sage Bauer.
Hi, I just wanted to touch on the other guy's idea about tiny homes. What a great idea. If the city could just allocate a patch of land to build homes out of old school buses, shipping containers, you tell each other, like, that would be amazing. That would be absolutely amazing. And I also just want to say, like, totally thank you for even having this. Like, this has been great. That's all.
Thank you. Thank you, Lasheen, for opening up the chat. I also want to be respectful of like the introverts and others that maybe don't feel as comfortable on the call. If there are any final things that you'd like to type in the chat, please share with us. I wanted to mention again, as we're taking this into all of this information into our retreat, I appreciate the contact information. I know this is a heavy lift in our city, and so we want to figure out how to partner together, definitely. And so thank you for everyone that is putting all their contact information down here. So I'll give the final call, if there are any last comments. And in the meantime, if any other commissioners would like it to follow up with any questions or have questions, please feel free to raise your hand and we can answer those too. Or you can bring forth your questions. I'm gonna give it to 7:40. Got to end on a even number.
Hey, I want to thank all the commissioners that came out tonight. Thank you, commissioners. Make sure you get your notes and let's have a very good conversation about this in a couple of weeks.
Thanks to our communications team as well for
I was just gonna
helping us out. To give
Yes,
props to my colleagues here at the city.
Yes, communications team. Yes, thank you.
Yeah, thank you, Lasheen and Remy, for being on the call this Thursday afternoon. Thank you, Todd, for managing the timer. Thank you to all the commissioners for being present, almost all of them being present tonight. We are on unprecedented territory hosting an event like this. And so I'm grateful for all those that have come on, that have provided your feedback, not only provided your feedback, but are willing to drop your contact information below. Again, we will post the meeting notes from tonight. And so if there's any follow-up, feel free to reach out to us on, or Todd, I guess it's Todd's email is public. If you get it to Todd, he will get it to us. So thank you again so much for being on the call. I just appreciate everyone for all of their comments, their feedback just definitely was taken to heart. And I'm looking forward to doing the work of meeting with our retreat. So thank you again. And I will call the meeting at 7:40.
Good night, everyone.
Night, everyone.
Night.
Thank you.
I know I tried to save as many emails as possible in here. Is it possible to save the chat from tonight?
Look at the chat.
Yes, we're saving the chat and the transcript as well.
Okay, perfect. This is great. Thank you guys so much for being here tonight and helping us out. Lasheen, it was grateful. I'm so glad to have you here to call out the names. It really made a difference. And thank you, Remy, for being here too. I really appreciate it.
No problem. Enjoy the rest of your evening.
Thank you. Bye.
Thanks, everybody.